Yes, although I'd emphasize that, again, there's overlap here.
Okay.
So in anorexia, often anorexia is actually of a combined type, but strictly speaking, there can be a focus more around food restriction and then a binge purge pattern, along with those other features like the lack of periods, reduced body weight, and the fear of fatness. In bulimia, there tends not to be so much food restriction of the nature I've already described. Mm-hmm. But what is pronounced is that there are episodes of binging. So what a patient may typically describe is that if they see a packet of biscuits, rather than having one or two, they'll eat the whole thing in one go. Or if there's a cake that's been made, they'll again just consume the whole lot. Guilt then kicks in, and the patient compensates by purging. So self-induced vomiting is the most common thing one might see, but there are also other ways that people try and control their weight in both conditions. Over-exercise is a very common one, and it's important to ask about that. And exercise, very broadly defined. So the obvious things would be things like running, swimming, cycling, and again, that will often be on a daily basis, quite significant distances, but also walking. Somewhere like London, for example, patients I've seen will walk everywhere. They'll walk to and from work, they may walk for miles. Now, of course, in isolation, that might be a healthy thing, but taking a detailed history and looking at the other symptoms, it's actually a compensatory behavior. Patients can also resort to taking medication, which may have been prescribed or, particularly with the internet now, a lot of medications easily available online. So it's things like diuretics, laxatives, and other tablets people may take to suppress their appetite, amphetamines as well, thyroid tablets. So it's important to try and explore what measures people take in order to try and lose weight.
Yeah, like we might be talking with someone and might be easy to be kind of in admiration at their physical fitness program, and under different circumstances that might be helpful, but it could be a way of really over-managing weight. Yeah, so we'd have to be careful that we're on the lookout for that, perhaps.
Yes, and I think the overarching theme here is around control. So irrespective of what we feel the underlying issue may be, something happens which means that the affected person feels the need to control what's going into their body. So that may be the food restriction, the obsessional thoughts around particular foods, and again, the over-exercise and the other things. It's about seizing control over one's body.
Yeah. So that's the theme that we could really look out for and spot. Yeah.
But ironically, for patients with bulimia, when they are going through this binge purge pattern, they often feel a lack of sense of control over their situation.